Hello everyone. Today we are going to start with a new chapter, that is viral infections of the oral cavity. So, what does virus mean? Virus means a poison. In Latin, virus means poison in Latin. Okay? In Latin. Virus means poison in Latin. Viruses are ultra microscopic, metabolically inert infectious agents. Ultra microscopic, as in the smaller than your microbial organisms. Okay, so they are very ultra microscopic, metabolically inert, and infectious agents. They live and multiply only in living cells. Okay, sequel of viral infection of host cell. First is acute infection, which is usually due to lysis of cell. Then you have latent infection with periodic activation of okay, so first is acute infection, which usually is due to the lysis or the breakdown of the cell, and then there is latent infection, which is an periodic activation that we will come to know later. Basically, latent infection means that the period of infection which comes, like if there is a period of rest, after that there is the activity of this infection, that is your latent infection. Then persistent infection, persistent for many years, like a chronic kind of infection. Then there is transformation of a simple infection to a malignancy. Okay, so there are certain examples of this: human papilloma and retrovirus. There are many, we will read. Now coming to the classification, this has been asked with your 10 marker. Coming to the classification, that is your RNA viruses and DNA viruses. So viruses is broadly categorized into RNA viruses and DNA viruses. In RNA viruses, you have orthomyxoviruses, paramyxoviruses, and in your DNA viruses, you have herpes virus. Okay, then in herpes, you have herpes simplex 1, 2, and varicella zoster and cytomegalovirus. So there is a huge classification that you have to remember. Mainly just remember RNA viruses and DNA viruses. In that you have orthomyxovirus, paramyxovirus, and herpes virus. These three are mainly what you need to remember. Then that is your classification. In orthomyxovirus, you have influenza. In herpes virus, you have herpes 1 and 2, and varicella zoster and cytomegalovirus. See, these names are easy to remember, right? Then you have something called Epstein-Barr virus as well. Human herpes virus 6, 7, 8, and similar herpes virus. Then you have pox virus, adenovirus, paravovirus, and then papavirus. Okay, now coming to the RNA virus, you have orthoparavirus and adenovirus. Okay, so these are all different type of a huge classification which is hard to remember. So I would suggest you to write down RNA virus and DNA virus, and then what you need to remember is in RNA and DNA viruses is in DNA you have herpes simplex virus. In that you have herpes simplex 1, herpes simplex 2, and here in RNA virus you have orthomyxovirus, paramyxovirus, and rhabdovirus. Okay, so coming to the herpes simplex virus 1, 2, then you have varicella zoster, and then cytomegalovirus, Epstein-Barr virus, then your pox virus, adenovirus, paravovirus, papavirus. Okay, now measles. Measles is an acute, highly contagious disease. Okay, it is an acute disease, it is highly contagious. Now, dermotrophic and endemic infection. Okay, so it is dermotrophic, that is, it affects your skin, and it is an acute, highly contagious infection. It is also endemic, which primarily affects children, occurring in many times, that is the epidemic form. Coming to the epidemiology, it has a worldwide distribution, if and incidence is increasing in developing countries. What are your developing countries? India is an example of developing country. Now there will be a lifelong community following an attack. There will be a lifelong immunity following an attack. Mortality rate is high among children and adults. Measles is highly contagious from the day first or second, before the onset of a serious illness or appearance of rash. Spread is through direct contact or droplet infection. Then you have your incubation period, which is 8 to 12 days. Then pathogenesis. Main cause, what is the causative of your measles, is paramyxoxyvirus. Okay, or you also call it PMV, myxovirus. Paramyxovirus is an RNA virus, as we studied in the classification. It invades the respiratory epithelium and travels through the bloodstream. After traveling through the bloodstream, it reaches the endothelial system. In that, it infects the skin, respiratory tract, and other organs. Okay, so measles has been asked for a 2 marker. So for that, just remember the basics of measles. Okay, then coming to the transient suppression of cellular immunity. Okay, now coming to the pathogenesis, the initiation. So first is your PMV. It affects the respiratory epithelium, and then it travels through the bloodstream and reaches the reticuloendothelial system, which is your skin, respiratory tract, and other organs. Then there is invasion of T lymphocytes with increased level of suppressive cytokines, which leads to transient suppression of cellular immunity. So it is going and suppressing your cellular immunity. Monocytes are mainly affected. Symptoms are mainly due to the infection in the respiratory epithelia or secondary infection with bacteria. Now, clinical features. Clinical features mainly occur in 3 stages: prodromal stage or eruptive stage, then you have your post eruptive stage. Prodromal stage, eruptive stage, and post eruptive stage. So in your prodromal stage, there is highly contagious so the measles is highly contagious in prodromal stage. Now coming to the incubation period, it is characterized by onset of fever, malaise, cough, conjunctivitis, and photophobia. Okay, so there is photophobia, there is conjunctivitis, there is fever and aches. Then there is lacrimation from the lacrimal sac, runny nose, eruptive lesions on the skin and oral mucosa. Now, skin lesions begin on face, in hairline, and behind the ears, which eventually spread to the chest, back, and other extremities. Now, the appearance is as tiny as red macules or papules enlarged. So, it appears as red macules or papules. Then these papules slowly enlarge and then they fuse together, okay, or coalesce to form blotchy, hyperpigmented, irregular lesions which are blanched on pressure. So when you put pressure, they blanch. Okay, gradually fade away within 4 to 5 days with fine desquamation. Okay, now coming to the oral manifestations, the oral lesions are prodromal, so they mainly occur in the initial stage of measles, which is 2 to 3 days before a cutaneous rash. Intraoral lesions are called Koplik spot. This is very important. Koplik spot has been asked a lot of times, and Koplik spot is a very important question as well. So we are going to read about Koplik spots mainly. So the intraoral lesion, which are called Koplik spots, occur in 97% of all patients with measles. So it is Koplik spots is nothing but an intraoral lesion which occurs in 97% of all patients who are suffering with measles. Now, white papules result. So, what are these Koplik spots? These Koplik spots are white papules resembling uh, table salt or crystals. So, basically, they resemble rock salt or your table salt with red base. So, they appear like table salt with red base. The appearance on the buccal mucosa. So where is the appearance seen? It is seen on the buccal mucosa opposite to the first and second molar teeth. Okay, so the appearance is on buccal mucosa, which is opposite to the first and second molar teeth. These spots are small, irregularly shaped flakes and appear as bluish white specks surrounded by a bright red margin. So these spots are small, okay, and irregular, and they are appearing as flecks. Small irregular flecks appear as bluish white specks surrounded by bright red margin. So they are surrounded by a bright red margin. Okay, so they are irregularly shaped, appear as bluish white specks surrounded by a bright red margin. So all this is the description of the Koplik spot. So Koplik spot firstly is an oral manifestation of measles, and it is seen in the prodromal stage of the measles. Koplik spots occur in 97% of patients with measles. What kind of papules they are? So they are white papules resembling table salt crystals with red base. They appear on the buccal mucosa opposite to first and second molar. Now these spots are small, irregularly shaped flecks which appear as bluish white specks surrounded by a bright red margin. Now increase in number, these bright red margins, which they increase in number and rapidly coalesce to form small red patches. These red patches are present on the palate and pharyngeal petechiae. Uh, Generalized inflammation, congestion, swelling, focal ulceration of the gingiva, palate, and throat may occur. So this is mainly about your this whole 5 or 6 lines is about Koplik spot. So Koplik spot has been asked as a 2 marker and 5 marker as well. So I hope you paid attention on what Koplik spots are. If not, you can rewind the video and see. Now moving forward with the histopathology. Histopathology is the pathognomic multinucleated giant cells which are called Warthin Fenkedi giant cells. Okay, so I'm just gonna call it WFG. Okay, so or WF giant cells. Okay, so these are pathognomic multinucleated giant cells which are seen mainly in the histopathology of the measles. Now the diagnosis is it is a combination of symptoms and rashes appear. So it is diagnosed on the basis of rash, hyperpigmented rash, and there is a tool which is used To confirm the serology, we use anti-measles IgM. Okay, anti-measles IgM. Complications is it could lead to gastrointestinal complication, which is your stomatitis, pneuma, or respiratory complications such as bronchial pneumonia, encephalitis, otitis media, mastoiditis, and it could also lead to neurological manifestations such as febrile convulsions, encephalitis, hematological thrombocytopenia purpura. Others include myocarditis, pericarditis, nephritis, and controlled measures is there is an MMR vaccine, measles vaccine, which is given. First dose is given in 9 months and second dose is given in 15 to 18 months. Okay, so that is about measles. Okay, for next is if we are going to deal with mumps, that is going to be in the second part of the video. Thank you.